Is it normal to have a bump on the bridge of my nose after a rhinoplasty? Well, assuming that the patient and the doctor didn't want a bump there, it's not the greatest thing to have a bump on your nose after a rhinoplasty. How does it happen that we get a bump after a rhinoplasty? Often the doctor or the surgeon is taking down the bump to make a relatively straight profile. They take down the bone, and that involves some bony instruments to almost file the bump down, because bone's hard. For the cartilage, if there's a cartilaginous bump or hump, we cut that away. We actually cut it with a careful knife, and we cut it away. So the bump is in the upper half, bony, and in the middle, it's cartilaginous. So we take it off in a couple ways. Now, after we do that, the skin then redrapes and forms onto the nose, and it takes a while for the skin to do that. The skin of the upper half of the nose is thinner than it is in the lower half of the nose, so it redrapes quicker than in the lower half. The lower half, it may take a year to year and a half to see all those little fine changes and to make the nose look as small as it's going to. The upper half may take only 6-7 months or so. Can a nasal bump or hump go away if it's not removed? But if a bump starts to come there after surgery, it likely won't get better. In fact, I tell my patients, if the bridge is too big after surgery, it likely won't get better. On the other hand, in the lower half, if the tip looks too big after surgery, that's likely to get much smaller because the skin is thicker here and it takes time to suck down on the infrastructure, on the cartilage. So why does a bump happen? Did the surgeon leave it there and just neglect it? Not usually. Think of it this way. We break our arm, we have a break in it, and the bone heals. Well, if we look at the x-ray, the bone actually sometimes has a little callus on it, where our bony healing is different than the way we set it. So our goal during the surgery is to take the bump off and to try to anticipate what's going to happen in a healing sense. But people heal differently. And so some of it is related to how the surgeon did it, and some of it related to your healing. And we can't always exactly control that. So what happens if you have a bump and all the rest of your nose is doing well and you want to get rid of it? When should I consider revision rhinoplasty? I don't like to do revision rhinoplasty for 8 to 12 months after surgery. If there's subtle things in the nasal tip, I like to wait a year. If it's the bridge only, I will do that sometimes in 8 or 9 months, because the result of this and the inflammation and the skin thickness and the skin redraping gets better faster on the upper half of the nose than it does on the lower half of the nose. And the subtlety to the lower half of the nose, we may not see all of it early on, and we likely have to wait to do a revision rhinoplasty. I've done lots of primary rhinoplasties, and I do lots and lots of revisions. I practice in Beverly Hills. There are many people that have had their noses overdone, and I'm having to revise their noses. It's a common thing for me. If you have an issue with your nose, if you've had a rhinoplasty and have a secondary problem, you're not pleased with it, call me, email me. I help patients like you every day, and I'd love to talk to you about it, see photographs of you, and even see you in my office, and potentially fix it. Thanks a lot for watching.